views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of Bronxnet or the program underwriters.
Welcome to Public Health America, a 30-minute program on Bronxnet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my distinct pleasure to welcome Senator Gustavo Rivera, New York State Senator of the 33rd District of the Northwest Bronx. Senator Rivera, thank you for joining us today.
It's a pleasure to be with you, Doctor.
Thank you. Please call me Bill. So I know you're working on a couple of incredibly important bills, one of them focusing on healthcare, one of them focusing on trying to address just all the terrible things that are happening by virtue of the opioid epidemic. Why don't we start with the healthcare bill? Tell us a little bit about it.
Well, I'm the chair of the Health Committee in the Senate, so it's obviously most of the bills that I deal with are health related, but this one is a particularly important one. It is called the New York Health Act, and the New York Health Act would create a single payer system in the state of New York, guaranteeing healthcare to every single New Yorker, regardless of their age, their gender, their wealth, or their immigration status. It is a way to say we need to take the market mentality, the profit motive out of healthcare, and it's something that every modern country in the world has had a version of for many, many years. So I believe that we should do it in this country, and New York should lead the way, and we would if we pass this bill, and I'm going to work like heck to make sure that we do it next year.
It sounds incredibly important, and obviously, you know, whether pre-pandemic or certainly during and since the pandemic, if it wasn't absolutely clear how important healthcare is, it certainly ought to be now. Let me ask you this, and if this is the wrong question, tell me and we'll move on. Does this bill link to expand? Is it different than the Affordable Care Act? In other words, like how does this relate to that, if that's a fair question?
It is a fair question. It is a very different thing that the Affordable Care Act. What the Affordable Care Act did, and I'll obviously laud President Obama for tackling the issue of healthcare, but I think that it was a limiting approach, and I'll explain. What the Affordable Care Act did is it did some very positive things. It set some standards for what an insurance product, right, a health insurance product should have. It related to pre-existing conditions, making sure that you are covered if your parents are covered up until 23, et cetera. All of these were standards that did not exist before. But then it created a marketplace. So it is a marketplace of private insurance companies that they would sell their products. Now, the products had to have a certain standard, and that is a good thing. But this is still involving insurance companies. What we want to do is take away the need to have insurance companies. We do not want to give you health insurance. We want to guarantee you health care, which is a very different thing. Because right now, if you do have insurance, the only thing that it guarantees you is have an insurance card in your pocket. But that card does not guarantee you care. And that's a problem. And this is something that we need to get away from.
So, and this is one of those situations where, you know, I know just enough to be dangerous. In these kinds of very important conversations, I know sometimes issues that are addressed or discussed are, okay, what do we do about pre-existing conditions? How is it financed? Are those things that you negotiate at the state level when you're defining the bill?
Yeah, that this bill is a very complicated bill, and let me just be clear about this. This is obviously not a small or inconsequential thing. We are trying to do an incredibly difficult thing, but it is an important thing. We want to fundamentally change the way that healthcare is delivered in the state of New York, and hopefully provide a model for the rest of the country. Right now, insurance companies are making medical decisions every single day. They're making decisions that have nothing to do with your medical condition and have everything to do with their bottom line. And that is a problem. And you, as somebody who is insured, people who are insured are constantly making decisions about their healthcare that have nothing to do with their healthcare. They make a decision about whether they go to the doctor because they don't know if they're going to have to pay the doctor, how much they're going to have to pay the doctor, whether it's going to be covered, whether the thing that they're going to need to be healthy is going to be covered. There are people, for example, that say, like, do not call an ambulance, even though I might be having a heart attack, because then I'll need to pay the ambulance. These are the kind of questions that we have taken as a given in our current healthcare system. And so all of these need to be changed fundamentally, and we will do it with this bill, but it is a very complicated bill that has a lot of pieces to it, including the financing, and we can get into that if you'd like. But I believe that this would actually create a system that will be much cheaper for a whole host of reasons than the one that we have right now.
And I would imagine that the potential reduction in costs would be perhaps due to better efficiency and also preventing serious illness by virtue of access to care. Is that fair?
That is fair. Listen, there's a couple of reasons why this would be cheaper. Number one, administrative costs. In private insurance companies use about 15 to 18 cents out of every dollar that does not go to healthcare. How about at 15 to 18 cents out of every dollar goes to insurance, goes to administrative costs. How about we go to 3 to 6 cents out of every dollar? Then second, how about we provide primary care? We guarantee primary care to people. Now, there's a whole bunch of folks right now that don't have access to primary care, but because they're human, they will still get sick. And many of them use what as primary care? The emergency room, which is the most expensive and the place where you actually most at risk, right? Then we actually negotiate on behalf of the entire state with drug companies. So we can get better deals from drug companies when we negotiate for 20 million people, which is the population of the state of New York. All of those things will mean that this will be a system that costs a lot less and will give, let's not forget, better quality of life to individuals and to the communities that they live in, because it will go down as far as mortality and morbidity. Both of these things will go down because you guarantee people care. All of these things will make for a system that is cheaper and provides better care for people. And that is what we need to do in the long term.
So compelling arguments, certainly. I've had several guests on that have considerable expertise and have commented on the next question I'm about to ask. Obviously, you represent the Bronx, and obviously it would benefit the Bronx. But let's agree, or let me state, there's a lot of variability in access to care. And I would suggest that there are a lot of families in the Bronx that don't have the kind of access that they really need. I also think that there are barriers related to language. I was talking to a superintendent not long ago, and 60% of parents in the Bronx have Spanish as their primary language, and sometimes only language. What consideration is there in this bill that would not only provide the access and the better care, but access populations that don't generally go to the doctor?
And that is exactly who it is that we are thinking about here. I would say, for example, when you consider places, many people get their care at hospitals, right? And you take safety net hospitals like St. Barnabas Health, right? St. Barnabas, which is right in the center of my district. And over 95% of the people who go there are Medicaid patients. So you have a hospital which is constantly underfunded, constantly at risk of having, they have less money than they need because they're constantly operating on very tight margins. And many times they will have they don't have the ability to be able to make up that money because most of the folks that they take in are Medicaid patients. And these folks they're serving are folks who are Spanish speakers or other folks from other communities. Now, how about we actually create a system in which in statute, we put the fact that the funding for that care has to be compensated at the rate at which it is offered. In other words, it is the rates to be paid to that hospital or to any provider would actually correspond to what they actually have to pay to provide that care. That's something that doesn't exist currently. All of these services means that all these institutions will be better funded, which means that they would be better able to serve communities which are hard pressed and have access issues all over the state. So we are thinking about them primarily, folks that do not have access to care right now, or whose access to care is unfortunately low quality. If we create one system for everybody, for every single person, we will make sure that it's a good one because it'll serve the governor, it'll serve me, it'll serve all the folks who I serve and who represent my district, and it'll serve the entire state.
That's great. You know, this is a really obviously important and fascinating topic. That said, I'm going to move to your second bill. I know we've talked about it briefly. You know, it's widely known that there has been an opioid epidemic that has certainly hit the Bronx hard and many urban and rural areas hard regionally and nationally. Tell us a little bit about the work you're doing there.
Well, the reality is that the overdose crisis that has only gotten worse during the pandemic, and certainly we saw a big spike on in the last couple of years, has been striking communities like the Bronx for a very long time. People have been dying of overdoses in the Bronx for decades, not just years. And we need to actually make sure that we can treat this as a public health crisis, not as a criminal justice crisis. And that's the big issue here. We need to switch we've started to switch some of this policy over, but unfortunately, a lot of our policy is still built around the idea that addiction is a crime, when addiction is a disease, and we need to treat it as such. So the bill, I have many bills around this issue, but one bill which is a little controversial, but I'm going to push for next year, is a bill that would create what are known as overdose prevention centers. This refers to places where people use drugs under medical supervision. Now, I will ask folks, right now, there are many places where people die from overdoses because of the stigma attached to drug use and because of the fact that they're doing it in secret. They don't know exactly what it is that they're putting into their bodies. A lot of this can be addressed if the people are treated as individuals with dignity in a place where they can be assessed medically, given the opportunity. If they want to use the drugs, I want to make sure that they do it safely, that they reduce the harm. It's called harm reduction for a reason. And we give them an opportunity in a non-stigmatized way to say, you need treatment, we can provide it for you. Not be like, you're a fiend or you're an addict, you're this. Let's treat the person like a person first. So the overdose prevention centers would do that. They work in many other countries, in Europe and in Canada, where I visited them myself. Ultimately, it is the next step in overdose prevention. I believe that we have to do this. It is controversial, but I'm ready for the fight.
So is there, I get the controversy, and I'm sure that there are voices that would say you're enabling a problem. But clearly the harm reduction approach is, you just defined it exceedingly well, so I'm not going to repeat it. Let me just ask this. Is there data from the other countries or the other places that you've examined that suggest that by offering a controlled environment under supervision, that it increases the probability that folks will get into treatment and receive the help that they need?
It doesn't suggest it, it outright proves it. And furthermore, you've had zero, I repeat again, zero deaths from overdoses in these facilities. Because if somebody were to overdose, they would have medical help available immediately. And you cannot seek treatment if you're not alive. So in a non-stigmatized way, if people are treated with dignity as human beings, as opposed to hiding out in corners because they feel they need to, because they are fiends or junkies or etc. When we use that terminology, what we're doing is dehumanizing these folks instead of treating them, again, as people who have a disease. So we should do it that way. And again, the data demonstrates clearly that this approach not only makes sure that people can can seek treatment, but most importantly, it saves lives. And you cannot seek treatment if you're not alive. So let's focus on that first. And that's precisely why I think this policy is necessary, and I will fight for it.
Agreed and well stated. So with about a minute left in this part of the segment, let me ask you this. And I think this is, look, I was doing NIDA-funded research 30 years ago, and we've come a long way. I mean, you can look at, very real things that have changed, decriminalization of marijuana, when, millions or hundreds of, thousands of people were being put into prison for, very small amounts of possession that wasn't, probably hurting anyone. And that's changed in many states. But there's still a long way to go. And it's complicated because, I remember when the director of NIDA said, I would never decriminalize cocaine because of the biology of that drug, but marijuana I would. And he said that 20 years ago when no one was saying it. Let me ask you this. If I had a nickel for every time someone made the point that you have eloquently made, that we need a paradigm shift, that these are not fiends, but they're human beings, and that addiction is a disease, to me, you're preaching to the choir. How do we change the minds of the masses? How do we try to really move the needle on that paradigm shift?
I believe that a lot of it is happening, or that's been happening already. Certainly, the reality is that in the last couple of years, the reason we're talking about an opioid crisis and an overdose crisis is because, let's be completely honest here, it was the white community, the white suburban community, that started seeing deaths in their own families. When it was young white kids or suburbanites, because of all the opioids that were given out. This whole conversation is happening right now around opioids that were prescribed at one point, and then when those prescriptions ran out, when people were already addicted, and we're going after those companies that did that. But the point is that when folks in white neighborhoods started dying, then all of a sudden it became an issue that needed to be dealt with. I remember having that happen in my own body in the Senate when I was still in the minority, and hearing some of my Republican colleagues upstate, because they were feeling it in their own neighborhoods, in their own districts, all of a sudden talking about dealing with it in a humane fashion and with treatment. So I believe that the change is already happening, that it is already coming. We just need to speed it up, and we need to face people who have the issues, who still carry that stigma. And it is stigma has a long shadow, and the stigma of drug addiction is still a real thing. But I believe that talking about it in conversations like this, and talking about it in your everyday conversations, and recognizing that it happens in every community and it happens in every family, we need to make sure that we save everybody's lives. So that's what I would say. We need to continue going in that direction. It's already started to shift, but it hasn't shifted enough.
Got it. So the critical, not to oversimplify, but the critical importance of explicit, open forums, engagement, describing the scope of the problem and the nature of addiction as a disease, and educating the public, and working with mobilized legislators and families and people of all walks of life. We're going to take a quick break, but when we return, New York State Senator Gustavo Rivera will tell us a little bit about his life story and what set him on the path to do this amazing work as a state senator. This is Public Health America. I'm Dr. William Latimer. We'll be right back. Welcome back to Public Health America. I'm your host, Dr. William Latimer. It's a pleasure to have Senator Gustavo Rivera here with me today, New York State Senator of the 33rd District of Northwest Bronx. So, Gustavo, we always ask the same question at the beginning, which is, where were you born, and what were some of your formative experiences?
Well, I was born in Santurce, Puerto Rico. I was born down there a while back. I grew up in a town called Bayamón, also in Puerto Rico. My parents are from a little town called Comerío, the population of which could fit a sixth of Yankee Stadium. It is not a large town. So I was born and raised in Puerto Rico. Went to college down there. Graduated from the University of Puerto Rico in 1998. And then I came to New York in 1998 to do a PhD in political science at the CUNY Graduate Center. You'll notice that I do not, there's no PhD next to my name when my name pops up. That tells you how far I got. I'm technically still a PhD student at the CUNY Graduate Center, but it was actually coming to CUNY and teaching at CUNY that actually kind of kicked my work into public service into the next level.
That's great. I have to mention I was married in Puerto Rico at a very, very, very small parish that does a lot of work for the community, and I've actually done a little bit of work there, as has my wife at the university, though I worked with schools. So tell us a little bit about what led you to attend college. Was it like an automatic? You knew it was going to happen, or what was the journey?
Well, for me, my parents are both first-time high school and college graduates of each one of their families. I should tell you that when I think about my story, I think my story is not one. It is not defined by struggle. It is defined by privilege. Meaning, I've been amazingly lucky all my life, and that means that I have an obligation. The work that I do now in public service has to do what I view as an obligation to make sure that I provide access to folks that are coming after me. But when I was younger, so my parents, both my mother and my father, were the first-time high school and college graduates of each one of their families. And my dad started a PhD in biochemistry, of all things, way back in the 60s. And because of my brother's, my brother was found to be autistic. And so to take care of my brother, he actually had to quit before he finished his PhD. So he always encouraged us, my younger brother and myself, to actually go to college and to seek PhDs if we wanted to do that. And eventually we both did. My brother came to the U.S. to Iowa State University before, and he's younger, but he left before I did. And then I graduated college, and then I came to New York to do a PhD in political science, since I wanted to seek that out, and I wanted to be an academic. I wanted to teach college. And even though I've taught college for many years, don't necessarily have a PhD to show for it. For that, I have to write a dissertation, etc. But being in those classrooms and interacting with students is actually a lot of what focused my work in public service came from those conversations.
Sure. That's great. And when you attended college at the University of Puerto Rico, were there, if I were to say to you, what were one or two, this is kind of a broad question, so forgive me, but if there were one or two things that you felt were really instrumental in helping you to succeed there, and also maybe set the table to some degree for your success now. You've been a senator for 12 years, or you've been a state senator for quite some time, and
11, yes, but
11. You've championed many bills, and you're the head of the healthcare committee, etc. Those are impressive credentials. Were there elements of your undergraduate experience that you think helped in your subsequent path?
I guess I would say that, yeah. I learned that a lot of it had to do with hard work. I knew that there were certain classes that were particularly challenging, and those are the ones that I actually enjoyed. I was never a straight A, kind of like an honor student. I was always an okay student, but it was those interactions that I had in those most challenging classes that kind of taught me a little bit about the hard work that was necessary to be able to succeed. But I would say that a lot of it came from when I came to graduate school. when I wanted to remain in academics and I wanted to actually be in front of a classroom. I knew that was something that I was good at doing. I mean, kind of talking to people and being able to be an educator was something that I wanted to do. And that was certainly encouraged when I was in college. And because I first wanted to go to law school, but then I figured out that some of the people at the time were in school with me, they were kind of just jerks, and they were the ones that were going to law school, so I didn't want to go with them. But then there was a professor who was actually an anthropologist who who actually told me that I should seek a PhD, that he wanted for me to do that. And then he actually helped me to, facilitate my application process, and then sent me off to New York, where I have been ever since, and has been a fantastic time here.
That's a great story. And, it points out, the significance of not just an advisor, but a mentor, somebody who really gives a person guidance and sees, a spark in them and what they can become, and then helps facilitate that. And obviously this gentleman did that for you.
Johnny Stinson was his name, anthropology professor in Puerto Rico. Brilliant dude.
That's great. That's fantastic. We've got about a minute left. If you were to give one kernel of advice to young people or people of any age in the Bronx or beyond in urban settings that might be facing various challenges or not to get to college, to sort of set that table for a profession as opposed to a job, what would that advice be?
It's about the work and not about the shine. There's folks who are about the shine, and they're just want to be seen as the ones that are doing things. I've always found that it's about the work, that doing the work, while shine might be something that gets you a little bit of notice in a particular moment, that does wear off. Work does not. Work, if you build work over time, focus on the work, not the shine. That's how you bring longevity, and that's how you do good things in the long term.
That's great. So the importance of a methodical work ethic. I want to thank New York State Senator Gustavo Rivera, and I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time on Public Health America. Take care.